Alaska Real Estate with Connie and Lottie, and I'm Lottie Michael. Today I'm visiting with my business partner for the last 24 years, Mike James. Let me introduce you to Mike. I'd like to introduce you to my partner, Mike James. Mike, tell us about yourself.
Good morning. I'm Mike James. I would do commercial real estate here with Lottie and Berkshire Hathaway. I've been here about 5 years now.
We've headed up the commercial division for Berkshire Hathaway for the state of Alaska for 5 years.
And Lottie and I have been working together for about 23 years here, and we've got...
How do you remember 23 years?
23 years, because I've been worked with Lottie a week longer than I've been married to my wife.
How's that?
And on a handshake. There's a partnership that we've got that we work together that it's just been a nice, comfortable ride. So we just trust each other impeccably, and it's been fun. But we've done, we used to work with Bond Stevens and Johnson for about a good 10 years, and then on to start a company called Commercial Real Estate Alaska. And then we were asked by Connie and Shimmer here with Berkshire Hathaway to come over 5 years ago and start the commercial division. So it's, we're enjoying that here and having a nice time.
Okay, so kind of wanted to talk about a couple of different topics. I'll throw them out and you can decide where you want to start. We've been very active in the medical real estate. We've been active in retail and office. Where do you want to start?
Let's start with the medical.
Okay.
So it's one.
All right. Give us the 2-minute tour of medical.
So I guess as you look at Alaska and our economy, we're a resource-based state, heavily dependent on energy and fishing, mining. One of the things that also, two things that stand out also are government and the medical industry. And the medical industry, and it's not just Anchorage, it's Southeast Alaska, it's Nome, it's Fairbanks, Bethel, Dillingham.
All the way down to Juneau,
yeah.
Haines.
Yep. And these are economic engines, generators for these area, bringing in professionals, nursing, physicians, techs for imaging, the whole gambit. And so as we look at the medical industry, that's done very well in Alaska. And it's not just one region, it's the entire state. Because of our large population, indigenous population, through BIA, they've been able to come in and have very strong healthcare facilities here in Alaska that are second to none. It's
outpacing a lot of the large medical providers.
Yeah, so as you look at the jobs that they do in Nome and then Utqiagvik, Dillingham, and then even here into Anchorage, if you look at how South Central Foundation actually competes with, to a certain extent, with Providence and Alaska Regional.
And we don't have managed care. So we don't have a Kaiser here or any of the other managed care. So the medical community is robust.
And so what we've got is, what's actually been nice is that with something like, let's say, South Central Foundation, they've been able to bring in physicians that might be younger and be able to see Alaska and been here for a few years. And, you know, you do a contract and sometimes they renew them with them. Sometimes they go home, but sometimes they like Alaska and they stay and go out on their own. So as you see certain specialists, it's been a nice foot in the door for the medical community to be able to bring them up here and get them to stay where it probably would have been more difficult, right? Otherwise on the private side.
So let's start at the top of the food chain, surgery centers. I see a lot of, not urgent cares, but surgery centers. I see a lot of surgery centers popping up. There's a process necessary to establish a surgery center.
So the surgery centers are ASCs, ambulatory surgery centers, and they have to run what's called, by regulations, through a certificate of need, a CON, and it's a very laborious process to go through and do it, and to get approval, because what they don't want is these popping up like McDonald's everywhere. That's a lot of time, a lot of money.
Nothing's wrong with McDonald's.
But a lot of money goes into it. And so you want to make sure there's a balance between surgery centers and under certificate of need and how it benefits the public. We don't want too many, but we don't want too little. So the state of Alaska runs through the CON process. Surgery centers fall underneath that. What we've seen is some of these newer ones, they're not really popping up as much. You're seeing is they're upgrading. So you'll see a few surgery centers. It used to be at 4100 like Otis in the red brick building there. That's relocated. Alaska Surgery Center is now down there off of DeBar, and they built a brand new building and moved all their services over there. They cannot, since they've already been in business, they can provide a certain amount of services with certain types of surgeries and a number of surgical rooms, but you can't just add another one because
you can't add just another room. The certificate of need allows for X amount of rooms for that certificate of need.
So when they built that new building, they still had to keep the same number of rooms, but they just made it's a single tenant building essentially now. So it's theirs, and they've got a nice entryway. They've got a nice a recovery area. They're able to make things 20 years newer than what they were before.
Right.
So that's where we've seen a couple of surgery centers that have popped up. There's others that are more of a one-room tech surgery center that we're able to get it under the cap, which is about $1.5 million. If you spend more than $1.5 million, it's a bust. If you can come in under $1.5 million, the Department of Health, if they go through and approve that, you have a much likelier chance of making that happen. It's pretty much not, because of inflation, not going to happen anymore. That 1.5 has been fixed for 2 decades, and now
It's never been adjusted.
no. And so now it's not even by inflation. So inflation's gone up with the cost of steel and air handling and everything else, equipment you have to buy. But that 1.5 is not. So it's pretty much not going to happen for anybody.
Okay. So we see these surgery centers all across Alaska, from Nome to Juneau, and everywhere in the middle. So that's one segment of the medical industry. The other segment I'd like to talk about is urgent cares. We used to call them, when I first was made aware of this, was in the 80s, and we called them doc in the box or McMedicine. But now it's a real thing. It's urgent care. So let's talk about that, Mike.
So as you look at the cost of medicine to you and me, and what it is for a provider, a physician that gets paid for me to walk in there with the insurance, sometimes it costs them more to do the work at their facility than what it is the insurance is going to pay them. So it doesn't always balance, where an urgent care, one can help you get in very quickly is one thing. A lot of times they have better hours, but also the convenience, because it's maybe in your neighborhood or you're in a business center instead of having to go across town. I've cut my thumb and I need to do something about it quickly, or I'm just not feeling well. I can walk into one of these urgent cares.
Almost a triage situation. Almost a triage.
But it's kind of the first line of defense that, being able to come in here first, get things taken care of. They see you and they can send you home, or they can refer you to a hospital. But you don't need to take up an emergency room for stitches I need to do in my thumb when somebody else is having a heart attack and really needs to use that side of those areas. So, and the cost of that bed.
Right.
So
right.
It's really behooves the community to be able to have more of these urgent care. So that's where you've seen a lot of Diamond.
We're talking Anchorage now. A lot of on the south side, as far as Huffman, then Diamond,
and then
Midtown.
You got about 2 in Midtown here. You've seen Providence Health Systems has gone through and provided their primary care with maybe a little bit of urgent care with some of them. So and that's been a nice feeder, I believe, to the hospital for them.
Right. We've talked about urgent care.
You see, it's not about just primary medicine. If we look at primary medicine, we've got, general practitioners where you go in and just for annual checkups. That's one where they don't make as much money as you look at specialists that might be.
It's a different business model.
Yeah. And so that one is one where they've been in place for a long time. A lot of these, they don't, it's expensive to have to move and relocate. Also, it's generational. You'll have physicians that I've had for 30 years that I've been seeing for my checkups and things. So you're starting to see a younger group coming in. And so we're starting to see a little movement here with primary care. We've had OPA recently picked up primary care. And
so that kind of went backwards. It went from a specialty expanding into general medicine practice as opposed to the other way around. So that's an interesting...
So it's a vertical integration, which becomes a feeder or OPA.
Orthopedic Physicians Association.
So we've got primary care, like we said, moving a little bit. And then I think a lot of the specialists we see are small clinics that you'll have here and there, moving into the office market, kind of getting away from the hospitals, where we've had really in the past 40, 50 years, you've had the hospital and it's surrounded by medical office buildings where maybe a physician built the building, put their clinic in there, a couple other clinics followed. It's 10, 20,000 square feet. And what you're now seeing is this next generation of movement is actually coming like in the Midtown, where the 188 buildings.
Several years ago, actually, I would say you and I were the ones that pushed the envelope for the UMed district, University Medical District. We moved it out. I think it was the first time we put in a urologist on about 20,000 square foot. And that was smack dab in the middle of Midtown. That was 20 years ago. Now what we're seeing is that UMed district, we still call it the University Medical District, but it has expanded out to Huffman, out to Midtown, even north.
But here in Midtown, what you're seeing is most interesting is a group of physicians have actually purchased the Wells Fargo corporate office building that's around C Street in Northern Lights. And Wells Fargo still is in there as a tenant with a sale leaseback, probably for a period of time. But the idea is a conversion to medical, where you have a few people coming off of Alaska Regional, a few people coming off of some of these smaller medical office buildings surrounding the hospital, like Otis, and coming in together as a group, buying the building and converting it.
Yeah.
Large chunks of these areas to their practice there. So what you had is an engineering office or an accounting office, and some of these buildings now are sharing space, depending on how you
elevator space with people in gurneys. So
I don't know if it's gurneys, but it is where you've got it is a health.
There was one.
It is a healthcare facility, and you're going to have people that are sick or hurt, and it's just so it's changing the look or the flow of a building that comes in. So that's the good and the bad as far as.
But that's just a transitional period. That building will, in my opinion, will go 100% medical. It might take 10, 15 years. The existing leases have to burn off on the strictly office, but I see that as going 100% medical.
I agree. And they feed off of each other, because you do one practice, I do another. My patient has some special needs that I can't address, that you're down the hallway or up same floors. It makes it easy to be able to refer within. As Lottie says, is that you start seeing this transition over time. Tough part is when you're not medical and you're the accountant or the engineer in that office building, the vibe changes substantially from
during that transition period. Yeah.
And then I think as far as, specialists that we've talked about too, let's see, you've seen some of these come up with South Central bring in physicians, and then some of them coming out into the private market here. We're starting to see specialists that you don't have to go down to Seattle for anymore.
Right.
We've got our own, kind of essentially in-house in here in Alaska. And that's what's been nice, is it's such a
benefit.
We have a broadened
right.
Variety of services that they can provide.
So when we're looking at medical office, there's several sites that would lend themselves perfectly for lease, or for physicians to own it, or for an investment group to buy a medical office building. But there's a lot of different avenues that'll take us into that medical office space. I think that's safe to say.
And what you say about like on the investment group, it's always very attractive, whether you're physicians themselves investing in themselves or outside investment group. It's a magnet when you look at a physician occupied building, because they don't
move very often, because the requirements for air handling, for plumbing, for electrical, it's just far and above standard office. So by the time you put all of those improvements into the office space, you just don't move that often. Once a medical space, it stays medical for a good time.
Average lease rate for an office is about 5 years, and you see about 7 years for a medical tenant.
Yeah.
And it's such a large amount of capital to invest in a new place when you do move. That's why it doesn't happen very often. So attractive for an investor, because they know I'm going to have this person in place. Buying a facility, if you have a vacancy, it costs you money. Every time you have for turnover, even if you have 100% occupied, but if I have turnover, every time somebody moves out, there's going to be vacancy. There's going to be downtime for tenant improvements, free rents, abatements, and then tenant improvement allowances. So having the medical positions in there makes life a lot easier for an investor too. They can kind of buy it and not think about it.
I think this has been very interesting. Next time we get together, we'll talk about strictly office, or maybe even retail or hospitality.
We can talk about office, and then how I could talk about office conversion, like we talked about today, kind of tripping from medical into office.
That'd be a good next session.
Mm-hmm.
We've appreciated the questions and comments that we've been receiving. Keep them coming. Let us know what you want us to talk about, and we'll try to address all those concerns and questions. Thanks, Mike.
Thank you.